going to have a presentation. Christy Patterson is going to lead it off. But just to remind, this is on our Healthy Minds Policy Initiative. Last Thursday, we had a media event for this, and this is round 2 of our coverage.
Good evening. I'm Christy Patterson. I'm the Housing and Community Development Manager for the City of Edmond. Over a year ago, community stakeholders met with city staff to discuss the needs of the community, focusing on the understanding of mental health, their needs, resources, and gaps. In August of 2021, the City of Edmond engaged Healthy Minds Policy Initiative to conduct an assessment of the mental health of our community. This was a collaboration effort between stakeholders that are here in the audience and the results that are given to us today with the plan to help strengthen our community together. Some of the stakeholders, there was over 60 of them that met over the course of the year, but some of them in the audience today are North Care, Edmond Public Schools, University of Central Oklahoma, several medical facilities throughout Edmond, Naomi, and the Edmond Family Counseling. On behalf of city staff and Chief Younger and I would like to introduce Zach Stakoff, Executive Director of Healthy Minds Initiative, to present the results of the mental health assessment for the City of Edmond.
Well, hello, everyone. Can you hear me all right? All right. Well, I am so excited to be presenting to you today about a year's worth of work on behalf of about 60 stakeholders, as was mentioned, that met over the course of a year to really dive into the data around mental health in Edmond and how do we help our residents lead successful, productive lives and recovery. And I do want to have a quick shout out here, say Mayor Davis has been attending. Thank you, Mayor, for your leadership, and Councilmember Mugg. And it's been wonderful to work with both of you as we've gone through this process. And Scott, and you came on, and we were so excited to have you as well. So what I'm going to do here today is give you a little bit of a rundown on our findings and recommendations. The work has resulted in about 27 action items that the City of Edmond Community of Edmond can pursue moving forward. So really quickly, Healthy Minds, just a little bit of background for you. We are a nonpartisan, data-driven think tank around mental health policy issues, and we work really at the community level and at the state capitol level in Oklahoma, really working on how do you reduce the barriers to getting access to mental health care in our state. Really, the opportunity, if we do this right, is wonderful. If we do this right, the opportunity is in every aspect of our communities. The opportunity is in education, where we see really a measurable impact on standardized test scores. If we do this right in education, if we see really at the criminal justice level, we see diversion, we see people staying out of jail and staying in their lives and in their jobs, and we see more effective use of both taxpayer dollars and healthcare dollars in our healthcare system. There's a wonderful stat out there that a heart patient, and this is one of our most expensive healthcare diseases, is heart disease, costs 3 times more if there is an undiagnosed or untreated mental health condition. So if we really address that, we can start to affect healthcare costs overall. We all look at that insurance bill if you run an organization, and certainly the city does. That's really a key issue here. So what happens now, unfortunately, is that we have a system generally, and this isn't true of just Edmond, this is really nationwide. We have a system that doesn't really meet the need. And in Oklahoma, we have about 59% of our residents with mental health conditions don't have their needs met. We do think that has gone up a little bit temporarily because the pandemic and what's happened to our communities over the course of a couple of years. We've seen disruptions in economies and social connectivity and things like that. We've seen actually about 1 in 2, about 50% of Oklahomans at some point during the last couple of years experience diagnosable depression or anxiety. So this is an issue that's really affected us all. Historically, about 1 in 5 Oklahomans has experienced a mental health condition, but we've all seen very likely in our families the effects of addiction and mental health issues, either personally or close to us over the last couple of years. What we've seen is that police become the default and de facto providers of mental health care in our communities and jails, and this is not the situation we want to see. We want law enforcement to be out enforcing the law and keeping us safe, and we want clinicians to be dealing with the issues and really getting people well. And so really what we're talking about here is an opportunity to have a connected, better connected, more resource system. So really what we did is, it was mentioned, there were about 68 people who came together and provided input on this. We looked at data that stemmed both from how are services accessed in Edmond or outside of Edmond? People often go out of town. To what is the level of penetration of those services so that our residents really getting the best use of our tax dollar, for example, at a state level. We looked at an evidence-based ideal continuum of care, which is really a fancy way of saying there are a lot of different ways that somebody can get mental health care. It's not just talk therapy. People get it their primary care. People get it through the hospital. People get it, in their school and around their lives and their community. And so there needs to be a certain level of capacity at each of those points. We roll that out. We look at what are those levels of capacity in Edmond and for Edmond residents, and we get some interesting findings. So strengths of Edmond: it's a wonderful community. It's a highly educated community. It's a community with resources. It's a community with active, engaged community leaders. Obviously, we're talking about this report that the community commissioned. That alone is really something to celebrate. This isn't happening across Oklahoma, even though it's a time of increased need across our state. The community of Edmond came together and said, this is an issue we need to solve. That's amazing, and we should celebrate that because that's really something that the rest of the state should take notice of. So a lot of wonderful things happening in Edmond. Some things that are happening, unfortunately, on the negative side is that there's significant access to care issues. People often go out of county even for mental health services in Edmond. Really, children and youth, really what we saw is that during the height of the pandemic, when we had sort of economic downturn, people lost their jobs, school disruptions and things like that, these stressors that we've all felt really are felt more at the children's child level and family level. And so really across the state and across the nation, we've seen increased ER utilization for suicidality, but in Edmond, we've seen data from the Integra system and others. The issues are significant here. Children are going to the ER at record numbers for suicidality and other mental health crises, and they are not getting served in the ER often. ERs are not necessarily capable of serving children in mental health crisis. They can stabilize them medically for the most part. They can keep them in a bed and in a safe place until an appropriate level of care or another bed opens up across the community or across our state. But that's really what's happening when a child goes to the ER, and that's happening at some alarming. There's a lot of good data in this report about that issue in particular, but we have seen in the Integris system some of the data. The Integris ER has been the #1 hit in terms of percent increase across the state. So they've seen about 117% increase in youth showing up at the ER with suicidality and a large percentage at the Edmond ER. And so that's not just Edmond, but that's certainly something that's happened in Edmond as well. Some of the basic data that we've seen right now, and the latest data we have around mental health, is there are about 15,000 Edmond residents with any mental illness. This could be schizophrenia as well as depression and anxiety. Really key, though, is there is about 10,000 Edmond residents who have a serious mental illness or a substance use disorder that require intensive treatment. So that's about 14% of our total population requiring intensive treatment. And that's really key because that's not necessarily just talk therapy. These are people who need something a little bit more than that. For children and youth in particular, we've seen some interesting data here. About 10% of our children have serious emotional disturbance, 15% have major depressive disorder. These are potential suicide risk factors. Substance use as well, and I'll go back to this other side and point out substance use for adults is rather high as well. So we know that there's need in Edmond. We know that there are treatment providers in Edmond who have been doing a lot of good work for a lot of years. It was mentioned a couple of them that are in the room today. This is a map that you're looking at of Medicaid providers in Edmond against census tracts of poverty. So we like to think of Edmond as an affluent community, and it is, but there's about a 10% poverty rate, and that's concentrated in certain areas of the city. There are providers who serve people on Medicaid and qualified based on their income level for that, but there's not enough capacity here. And a central tenet of our report really is that people who are on Medicaid or uninsured aren't getting the same level of access to state-funded resources as the rest of the state, and I'll talk about that in a minute. But there's also a lot of good things happening there. People in Edmond are going out of the community quite often for services. #1 reason why adults in Edmond leave the community for services is therapy, crisis services. For children, they're going for crisis services quite a bit. They're going down to Red Rock, they're going to Oklahoma City, and they're getting crisis intervention. The #1 reason children are leaving Edmond is for crisis services. So these are immediate, potentially life-threatening issues that are happening in our families, and they're seeking care outside of the community. We know that this issue in terms of seeking care outside of the community affects the police department quite a bit. So when there's somebody who needs to go to treatment and police transport them to treatment, which is wonderful. If somebody just needs treatment, we want that to happen, but they're having to go out of the community quite a bit. We had seen at some point during this study in 2021 about 50 mental health transports per month, about 100 officer hours spent per month doing this. So we knew that there is a need for more localized coordination around crisis so that we utilize officers' time well. Now, next steps to talk a little bit about some of the opportunities for action, and I mentioned some of our sort of intensive services that we need. Really, what I want to highlight here is the Certified Community Behavioral Health Clinic model. It's a wonderful model that is operating now across our state. All 77 counties in Oklahoma have access to a CCBHC, and this is important because these are facilities funded by the state to offer indigent care and Medicaid services and private insurance services across that continuum of care that I mentioned earlier. So these are early needs is all the way to intensive services. These are the kinds of community organizations that are offering more than therapy. Edmond has a penetration rate of about 8% for adults. 8% of the Edmond residents who need that level of care are going to those types of facilities. Across the state, it's 28%. For children, it's 17% are getting those level of services. Across the state, it's 88% for children. So there's a big gap here in Edmond residents accessing that level of care. I will say we've had a wonderful dialogue with North Care, which is the assigned certified community behavioral health CCBHC for Edmond. They've been at the table. We've got a representative here in this room. They are opening with support from this council a new urgent recovery center serving Edmond directly. It's a wonderful, wonderful initiative that will really help offset some of what I just told you. Will be an entry point into the crisis system. This will help people get help. This is wonderful. We should really be highlighting that as a key success here because it's really going to help the whole system. Those providers who have been operating in Edmond are doing this without that backup. They're going to continue to do this. That's what they do. They're good at this job. But we need a holistic community approach so that they're not overwhelmed as well, and that's key. I mentioned community crisis coordination as a key opportunity. What I'm really talking about here is that we're recommending protocols be in place between emergency rooms, schools, other providers, police departments, that really make effective use of all of these disparate resources that people encounter in their daily lives. And that we really have an approach to this that is holistic. We need to expand the full continuum of care. We need to look at primary care, and we need to look at people with private insurance. And this is something that's been important for this process, is realizing that Edmond has a higher percentage of residents who have private insurance than the rest of the state, which makes sense. But there are a lot of issues with that because private insurers do not pay for intensive services. There are issues on private insurance with getting into providers months. People are spending waiting for this. And it's a sad reality that in Oklahoma, often people on Medicaid have better access to care than private insurance. So the issue of mental health parity, are you getting added discrimination around whether you're accessing a mental health provider compared to a physical health care provider? And a key example of this, I will tell you, Oklahoma residents have to go out of network for behavioral health care almost 8 times more often than they go out of network for physical health care. There are big imbalances in this system that are big policy issues that we've got. The Edmond really is getting the brunt of this because of the issue of so many residents having private pay. But there's a lot of opportunity here. There's already been partnerships announced between North Care and Edmond Public Schools, and there's wonderful work happening in the schools, and I just want to celebrate that as well. But if you go into this report, again, there are about 27 action items that we can really handle over the next several years. And what does this mean? So this is a report, this is an action plan, this is a strategic plan, and this is a needs assessment. But it's a document that could very easily be put on a shelf and stay there. What I think the community wants is for real tangible work to happen in these 27 goals, to really come together and continue to come together and widen that net. Faith leaders, school leaders, people who are at the table who can really have an opportunity to make a difference in our system and make better effective use of our time and resources. So happy to answer any questions, and I'll end there. Thank you.
Thank you very much, Zach. Any questions from council? It was a pleasure to be serving, be a part of this total initiative because, as we said before, it just wasn't the city of Edmond, it was the Edmond community. Regionally, we all came together to say, hey, we're better together than be separate on this whole issue. And let's work together, continue to work together in the future to help mental behavioral health issues that are plaguing our community right now.